Hello everyone, my name is Breanna Sims and this is my clinical leadership presentation on safe staffing ratios to increase positive patient outcomes and decrease nurse burnout in the ICU setting. Due to the result of mandatory overtime days and short staffing in the ICU setting, there have been an increase in staff turnover and nurse burnout, which has led to an increased risk in patient outcomes. The project objectives that I have outlined for this project are to increase positive patient outcomes and safety, identify stressors in the workplace that have led to burnout, and implement burnout reduction programs that can aid in staff retention. Let's start with some of the facts. Medicine is always changing, thus the world of nursing is always changing. The large population of baby boomers are aging and requiring more inpatient health care. Increased age leads to more complex health issues, which leads to more medical intervention. Burnout is characterized by emotional exhaustion, lack of motivation, and feelings of frustration. Many nurses report that they have an insufficient amount of time with their patients. If nurses are unable to have a sufficient amount of time with their patients, how can critical changes in status be recognized and managed? Burnout lowers nurses' quality of life, performance level, and organizational commitment, and increases their intent to leave the job or even death. A failure to prevent nurse burnout can lead to increased sentinel events caused by overwhelmed nurses. The ANA conducted a wellness survey of more than 9,500 nurses, and of that survey, over 34% of nurses rated their emotional health as not or not at all emotionally healthy. Most nurses surveyed said that they have felt stressed, frustrated, and overwhelmed. Close to half of nurses responded yes when asked if they have had any extremely stressful, disturbing, or traumatic experiences while on the job. Among nurses who said they intend to leave their position within 6 months, close to half said work negatively affected their health and well-being, as the top reason being insufficient staffing. So why is this an ongoing problem? The recommended nurse-to-patient ratio in the critical care setting is 2-1. In many instances, nurses are being tripled due to little to no staff available. If one nurse is caring for 2 or more complexly ill patients in a higher acuity area, how can he or she adequately care for them in a timely manner? Less amount of time to adequately provide patient care causes the nurse to feel rushed to catch up with the rest of their day, leaving them feel like they haven't gotten anything done. Inadequate time equals missed symptoms, which can lead to worsening outcomes. The ANA reports that up to 50% of nurses feel like they have an insufficient amount of time with their patients. Higher ratios can increase med errors and increase failure to notice changes in patient conditions. The first step in my plan development was to reach out to the staff about personal concerns. Of the 30-plus full-time staff members that I spoke with, all voiced obvious signs of burnout. Many were open and upfront about taking medication for depressive thoughts due to mental stress from work. I reached out to the administration staff about what things they had in order to promote positive well-being in the workplace, and I was shocked to say they had really nothing in place to aid for the core staff. For the clinical management staff, they offered a summer hours program that allowed for staff members to take part-time hours during the summer to help relieve stress from work. Yet they had nothing in place for the nursing staff that's there to staff the hospital 24 hours a day, 365 days a year. I also asked if they had anything in budget to aid in nurse burnout, and they said no. If you think about it in the long run, no budget for burnout relief costs the hospital more to train new staff for significant amounts of time in orientation than implement retention programs to keep their staff nurses. When putting the plan into action, I looked for both long-term and short-term goals because this is a very strong topic. The My Wellbeing Index is a 100% anonymous tool that evaluates multiple dimensions of distress in just 9 questions. This app allows all healthcare professionals to accurately assess well-being. This program is being utilized by over 800 healthcare organizations to allow for valuable insight about well-being. This data collected could help aid in therapy programs and allow for healthcare organizations the means to promote wellness and healthy lifestyles. After my practicum hours, I reached out and was able to sit down with the CNO, and we implemented the How Was Your Day QR questionnaire. This questionnaire hits on the same topics as the My Wellbeing Index, but on a smaller scale. All healthcare professionals throughout the hospital have the opportunity to anonymously gauge how their day has been, what could change, what could have happened differently, and it also gives them the opportunity to spot live staff that has been helpful during their shift. Thinking long term, what does the staff really need? This staff in this ICU setting is doing all daily care activities, so they could benefit from either a CNA or a float nurse for resources, which could aid in positive work environments, and it would give nurses the confidence in their ability to perform their job from their leadership standards. As of March 2022, the United States is investing $103 million to improve healthcare retention by implementing burnout relief programs. The Promoting Resiliency and Mental Health Among Healthcare Professional Workforce helps healthcare organizations establish, improve, or expand evidence-informed programs that promote mental health and well-being among their workforce. And the Health and Public Safety Workforce Resiliency Training Program will offer support developing tailored evidence-informed health professionals and nurses training activities to reduce burnout and promote resilience. Some potential positive outcomes that we could see should these changes be implemented are an increase in job satisfaction and a decrease in burnout, increase in patient satisfaction and patient safety rates, a decrease in adverse events and readmission rates throughout the hospital, and a decreased hospital-acquired injuries and infection. Although it would cost the hospital more money to hire staff to accommodate for safe staffing ratios, it wouldn't compare with the amount of money loss the hospital is seeing to constantly have to do orientation for new staff coming in to replace the old staff. This concludes my presentation. Thank you so much.